Election Day is perfect time to try to get people when they're already coming out.
We need a sign definitely here.
We're having millions of people all over voting who wouldn't normally get out to get a vaccine. So there's going to be nurses from both the VNA, from the different schools, from the city of Hartford. So we've got folks coming all day. Good morning. After you vote, you can come out front. We're going to do some flu or pneumonia vaccines. We're here doing what they call vote and vax. After you voted, gotten through the line, come around front if you haven't had your flu vaccine, okay?
Influenza presents a really important public health challenge. There are about 200,000 hospitalizations every year from the flu, and about 36,000 people die from the flu. Where would be an extremely convenient place? A place where folks were already gathering in large numbers during the flu shot season, where we could make flu shots available. Very quickly, we came up with the idea of polling places on Election Day.
With me working, I really don't have time to make an appointment to go to the doctor to get my flu shot. So it's very convenient that I was able to do that today.
Sometimes people do not have access to clinics or to hospital care or even physicians' offices. And so one of the goals for us in vulnerable populations is to make sure that we think about interventions that can improve people's health by offering them where people live, work, learn, and play.
Voting over here, flu shots over here.
The flu shot's recommended for folks who are age 50 and over, and it's recommended by the Centers for Disease Control and Prevention.
Is it your first flu shot?
Yep.
Yeah, it's our first flu shot.
It's also important to get vaccinated as a way to better protect the community that you live in.
Okay.
Little prick.
Oh, that's it?
All done. Told ya.
Jeez.
Several years ago, there was an influenza outbreak in Guilford County. For the sake of everyone's health, we want to alleviate that by a simple, quick injection.
The way Vote and Vax works is that the program begins with a conversation between a local public health provider, such as a visiting nurse agency or a local health department, and a local election authority.
Our elections board gave us a list of all of the voting sites. And so then it was just a matter of who could accommodate us, because one of our goals is to make sure that we do not interfere with voting.
Vote and Vax grew because when you explain the program to people, they get it. They understand that this makes perfect sense.
If you're looking to start a flu clinic like this, it's actually quite easy. And there's a whole cookbook that's already been prepared. And the important thing is you don't have to reinvent the wheel.
The program has developed very, very quickly. In 2004, there were about 20 clinics. In 2006, there were about 100 clinics. And in 2008, we've had about 300 Vote and Vax clinics in 42 states across the country.
The voting took about 25, 30 minutes. The vaccine was a whole lot easier. It was less painful, too.
This also proves that in an emergency, you could vaccinate large numbers of people by having them go to their polling places.
It's a way of providing a benefit to the community early in the flu shot season, and this is an infrastructure that might in fact be extremely useful at a time where we might have to respond to a potential public health challenge of an influenza pandemic.
We're showing the community, you're our patient, and we're going to keep you healthy.
When you stop and you think about it, you go, oh, of course, why aren't we doing this with all sorts of public health interventions?
There you go. You have a healthy season.